What is an ostomy after diverticulitis colectomy? Have you ever wondered what happens when diverticulitis leads to a colectomy? An ostomy might be part of that journey. An ostomy is a surgically created opening, called a stoma, on the abdomen. This stoma allows waste to exit the body through the abdominal wall instead of the usual route through the colon and rectum. This procedure is often necessary when a section of the colon affected by diverticulitis is removed, and the surgeon cannot safely reconnect the healthy ends of the colon right away. In the context of diverticulitis, there are two main types of ostomies, colostomy and ileostomy. A colostomy involves bringing a part of the colon, which is the large intestine, through the abdominal wall to create the stoma. Waste then passes through this opening into a colostomy bag attached outside the body. This is commonly done after removing the diseased sigmoid colon, which is often affected by diverticulitis. On the other hand, an ileostomy involves bringing the end of the small intestine, known as the ileum, to the abdominal surface when the colon cannot be used for the stoma. The choice between a colostomy and an ileostomy depends on the specific circumstances of the surgery and the patient's condition. Ostomies can be temporary or permanent. For instance, in emergency surgeries like Hartmann's procedure, the diseased part of the colon is removed, and the remaining colon is diverted to a colostomy. The rectum is closed off temporarily, allowing the colon to heal. If the patient improves, surgeons may later reverse the ostomy by reconnecting the colon and closing the stoma, restoring normal bowel function. The ostomy serves several important purposes after a diverticulitis colectomy. It allows the bowel to rest and heal by diverting stool away from the surgical site. This reduces the risk of infection or leakage if the colon ends cannot be safely reconnected immediately. It also helps manage complications when inflammation or infection makes primary reconnection unsafe. Patients with an ostomy use specially designed bags to collect waste, which requires education and support for proper management. Most colostomies performed after diverticulitis surgery are temporary and can be reversed months later once healing is sufficient. In summary, an ostomy after diverticulitis colectomy is a surgical opening created to divert stool through the abdomen when the colon is removed or cannot be reconnected right away. It is a common and sometimes necessary step to ensure healing and prevent complications after surgery for diverticulitis. Depending on individual healing and surgical decisions, the ostomy may be reversed later, allowing for a return to normal bowel function. Always consult with healthcare professionals for personalized advice and support regarding ostomy care and management.